Good afternoon, this is Dr. Vikas. Today we shall talk about hair loss. Hair loss or alopecia means loss of hair from the scalp. The causes of it may be genetic, may be hormonal, and other causes also may be present like autoimmune conditions as in alopecia areata, infections, maybe fungal, micronutrient deficiencies, hormonal disbalances like in hypothyroidism, PCOD, which is polycystic ovarian diseases, and pregnancies. So prior to going for any treatment for hair loss, it's very essential to go for a proper physician who shall find an accurate cause of the ongoing hair loss in the patient and address it accordingly. In the past decade, it has been seen that the advent of hair loss is seen starting from an age of 22 to 23 from nowadays, which may also include a lot of etiological factors or environmental factors caused by the patients also, like hair straightening or chemical usages or excessive use of gels, dyes, including TDS of water. Female hair loss and male hair loss need to be treated separately and as a different field of science. We need to also see micronutrient deficiencies and do certain blood tests, as in the case of serum ferritin, serum vitamin B12. We need to see the cholesterol levels, the sugar levels, and we also need to find out by examination of the scalp through clinical examination and videoscopy to rule out any causes of cicatricial or scarring alopecia, which needs to be treated differently altogether. Not every hair loss patient is a candidate for hair transplant. We need to set him in a grade of hair loss, whether he is facing just hair thinning or a balding patch. A hair thinning patient may be treated accordingly with medications or certain adjuvant therapies like platelet-rich plasma therapy or stem cell growth factor therapy. And whereas if the patient has a balding patch, then we need to take a call on whether to implant hair, when to implant hair, what is his age, whether he is the right candidate for hair transplant, and which technique of hair transplant, the two being follicular unit transplant and follicular unit extraction. So all in all, in a nutshell, first for identifying the cause of the hair loss. The cause of the hair loss, we need to separate it, whether androgenetic or etiological in the sense of infections, hormonal disbalances, micronutrient deficiencies, and then take a call whether to go for medical therapy or surgical therapy. After this call is made, then the patient should be sitting in front of the physician and taking a call when and how all these steps should be followed. Even in the case of surgical intervention like hair transplant, the post-operative medication therapy and supportive therapies like platelet-rich plasma is mandatory for not only the rise in the growth of the follicles, but also the controlling of the ongoing hair loss of normal hair. A proper evaluation of donor area is also must, along with seeing the pattern of hair loss in the precursor, which may be the parent or the grandparent, both paternal and maternal of the child. Reason being that it's a dominant condition, either from paternal side, father's side, or maternal side, mother's side. If any one gene is expressed within 3 generations, it may lead to an expression of alopecia in you. So identification is must. The pattern of the precursor also, especially in the donor area, to determine whether which is the permanent zone and non-permanent zone for the extraction of the follicle is a must. Redefining of causes, treatment and surgical intervention along with the patient, proper discussion, and then taking a decision for either medical therapy or surgery after doing proper blood test. Fitness is mandatory. In case if you need to follow me up and take my advice on your hair loss concerns or any balding concerns, you can contact me on Lybrate.